kind of background is this?
Good afternoon, sir.
Good afternoon.
So we will start in 5 minutes.
Okay, madam. Fine.
Megha, you can start now.
Okay, sir.
Since I see that most of our participants have joined, so let's kickstart today's session. A very good evening to all present here. I, Tanya Mathur, Council Member, SPER Student Forum UP, take this opportunity to welcome you all on the behalf of the Society of Pharmaceutical Education and Research, SPER, for a virtual expert talk organized in association with SPER Market Research on the occasion of World Cancer Day. This year's dedicated theme is Close the Care Gap, by which we unite and take action against a major health monster like cancer. Now I would like to invite Gayatri Singh, Vice President SPER Student Forum UP, to elaborate the goals and missions of SPER as a non-profit organization in the field of pharmaceutical sciences.
Very good evening to our guests and our respected mentors and everyone. So, Society of Pharmaceutical Education and Research (SPER) is a scientific and educational non-profit organization committed to promote the highest professional and ethical standards of pharmacy and to work for the growth, development, and betterment of the same. It is a registered society under the NC Societies Act 1973, number 44 of 1973. Our society serves as a platform for all the pharmacy professionals to flourish and put together as a whole. SPER is one of the leading pharmaceutical associations in the country working towards the interest of pharmaceutical professionals. With a member base of around 3,500, SPER spans across the country and holds 13 state branches. With the strength of these diligent and hardworking individuals, we are definitely striving towards a reform in the society.
Thank you, Gayatri, for presenting forward the unmatchable mission of SPER as a society working towards the expansive field of pharmacy. As we proceed towards the relevance of World Cancer Day, I would like to invite Kishori Gupta, Secretary SPER Student Forum UP, to shed some light on the demonic monster like cancer.
Okay, so what is cancer? Cancer is a disease basically in which some of the body cells grow uncontrollably and spread to other parts of the body and damage the normal tissues. Cancer is the leading cause of death worldwide, accounting nearly for 10 million deaths in 2020 and nearly 1 in 6 deaths. It causes 4,59,000 deaths every year, and over the past few years, there were around 1.6 million cases in the region. Almost 7,34,000 individuals are being diagnosed with cancer every year, and in 2040 year, it is predicted that the diagnosing rate will be 50% higher. Now talking about this year's theme, the close the care gap, which is about understanding the inequities in cancer care and taking actions to make necessary progress to address them. As this is a 3-year campaign, the objective for the World Cancer Day 2020 was realizing the problem. The objective for 2023 theme was close the care gap, uniting our voices and taking actions. And the objective for the World Cancer Day 2024 would be together we challenge those in power. Now, on World Cancer Day 2023, various activities will take place globally, including the 5K challenge by the Union of International Cancer Control, UICC, encouraging individuals from all the backgrounds to participate in the activities such as running, cycling, swimming, walking to symbolize closing the caring gap. Additionally, there will be 21-day challenges for individuals to create new healthy habits, awareness regarding the cervical cancer, and educate themselves about the inequalities in accessing the cancer services.
Thank you, Kishori, for making us aware of the fact that cancer is indeed an alarming condition and causes a major health concern as one of the most widely spread diseases in the world. So the honorable speaker for our today's session will be Dr. Guruprasad Bhat, Associate Professor and Chief Medical Oncologist at KIMS Mangalore. Dr. Bhat has been working as a consultant medical oncologist in Mangalore since the last 9 years. He has been associated with the academic profession since the year 2014 and has worked as an assistant professor in various reputed institutes like KMC and Yenepoya Medical College, Mangalore, before being promoted as an associate professor in the year 2020 and is currently serving on the post of Chief Medical Oncologist at KIMS Mangalore. He completed his MBBS from KMC Mangalore and MD in General Medicine from Sri Siddharth Medical College, Tumkur, and a DM in Medical Oncology from Kidwai Memorial Institute of Oncology, Bangalore. He is also an active member of Indian Medical Association, Association of Physicians of India, and Indian Society of Medical and Pediatric Oncology. Along with that, he has under his name many research publications and articles in well-reputed journals. He is an avid part of research and clinical trials concerning oncology, having been a research evaluator for RGUHS clinical trials in oncology in 2015 and taking part in biosimilar trial for Samsung for trastuzumab in breast cancer. He is involved in the ongoing randomized double-blind phase 3 study to compare the efficacy, safety, and immunogenicity of proposed rituximab biosimilar with MabThera in subjects with previously untreated stage 2nd to 4th low tumor burden follicular lymphoma. He was selected among the top 6 young oncologists in India by TYSA Oncology and have a number of awards under his name. With that, I would like to welcome with no further delay our speaker, Dr. Guruprasad Bhat, Associate Professor and Chief Medical Oncologist, KIMS Mangalore. Sir, the stage is all yours.
Thank you, madam. Can you share the PowerPoint if you?
Naman, can you share the PPT, please?
Is this visible? Is my screen visible?
Yes, sir, it is.
Screen is visible, right? Hello?
Yes, sir, it is.
Yes, sir, your screen is visible.
Yes,
Okay.
it is visible.
Okay. So the topic for the today is closing the gap in cancer care. We all know that cancer is a global burden and it's one of the leading causes of deaths right now. But there's a lot of discrepancy between what is the actual proposed treatment which is available worldwide versus what is actually available in India versus what the diagnostic treatments are available or versus what are the awareness facilities which are or screening facilities which are available in major cities and towns. For example, we have some newer treatments available right now, like immunotherapy or CAR T cell therapy. CAR T cell therapy is right now available only in Mumbai for very select patients. The whole of India may need it, but very few patients are able to access it. This is not even available in major other metros of India. Only in Mumbai has it. Whereas immunotherapy per se, like example, nivolumab, pembrolizumab, avelumab, these are the higher end drugs, but they are too expensive right now. They cost a couple of lakhs and given every 3 weekly for 1 to 2 years. So it costs a huge amount for majority of our patients. They may not be able to afford. Whereas country like America and all, they get it under the insurance schemes and everyone who is born there gets these drugs free of cost. It is not so in India where majority of our patients pay it through their pocket, and the government schemes may not have these under their um, care. So we have a lot of difficulty in treatment. We have a difficulties, for example, in treatment facilities. For example, the childhood cancer survival anywhere in the world is around in higher income countries around 90%, whereas in low income countries is as low as 20 to 30%. This is a very sad state because childhood cancers are all curable. When you say cancer, childhood cancers are almost curable, but it is not so in low income countries because the available resource persons for them, that is the pediatric oncologists, are very few. Even in a state like Karnataka, you'll have hardly some 3 or 4 pediatric oncologists. So it's a pretty low number we have of pediatric oncologists. The facility, the drugs may be too expensive. The trained person for the same may not be available. So we have a lot of gaps. This is in treatment facilities. So I'll be explaining what are these gaps which we have in these, and these are costing us lives. But the most important gap which we all have is awareness of this disease, and who can get this disease. What are the symptoms which you need to be worried about? So this is the where most of us face the problem, because in India almost 87 to 88% of them are diagnosed in advanced stage. So we want this to change. We want them to come in early stage when the symptoms are there, not to neglect it. That is why this podium we have taken, so that the awareness spread and more people come to know what this disease is and they help people out. So there are a lot of barriers which we face. The most common barrier which we face is the gender barrier. Uh, in India, when we take the two most gender barrier, that is a male and female, even females have more numbers of cancer. If you take more male and female numbers together, the most common cancers occurs in the first top 1 and 2 cancers in India is breast and cervical cancer. These are the top 2 cancers of India. It is not the males who develop more common cancer, the females, but they present pretty late because they think of all other things rather than coming for a therapeutic aspect or a diagnostic aspect. Poverty and socioeconomic status also plays a role, and there are barriers there. Education plays a barrier. Age discrimination plays a barrier. That is the younger age or the extremes of age. Elderly also have the age discrimination. The rural-urban divide. I'll be explaining each of them in details. So the most important barrier which we face as oncologists is the gender barrier, where there's negligence, both by the patient and by the family members. And there's this negligence we need to remove by awareness. Like, I can ask you a simple question. The question asked is, how many of you have taken a vaccine for cancer? How many females in this group have taken a vaccine for cancer? Most of you would have taken a vaccine for corona, but for cancer, there's a vaccine. And the second most common cancer is a cervical cancer. And for that, there's a vaccine. It hardly costs 400 rupees. In India, not many take it. That's a major care gap which we face. It's 400 rupees in government sector, whereas in the private sector is hardly 1,200 rupees. And cervical cancer can affect anyone, and there's a vaccine for it, and not many take it. Gardasil, Cervarix, these are the 2 vaccines. Ideal age is 9 to 26 years. Best is before the age of 20, but this gap is always there. Um we always feel that they don't take the vaccine. The only indication where they take is if the grandmother has the cancer, the granddaughter takes a vaccine. We explain them about it. We, our own medical students don't take it. Pharmacy students don't take it. Nursing students don't take it. The only indication when they take is probably when their grandmother has it, they will take it. So all said and done, the most common cancer is a breast cancer. The second cancer is cervix. The third is a head and neck cancer and the lung cancer and the colon cancer. We see that the top two cancers in India are still the breast and cervix. Cervical cancer, there's a vaccine for it. We can prevent it. Not many take it. Through this podium, I would like to ask each and every audience, if you know anyone of the age 9 to 20 years or 26 years, females, kindly advise them to take the vaccine. It is 016 or 026, one now, one at 1 month, another at 6 months. These are available both in your pediatrician can give it, your gynecologist can give it, or a physician can give it. Ask for that vaccine for cervical cancer. It is available. Like for corona, there's a vaccine. For cervical cancer also, this is a vaccine. The cervix is a part which is the lowermost part of the uterus, which is also the mouth of the uterus, and that part develops the cancer. The lowermost part of the uterus develops the cancer, and this commonly presents as um, in the age of 50 to 60 postmenopausal ladies as a bleeding. If your menses stops and after that bleeding still persists, or after 2 to 3 years bleeding still persists, it comes back. Uh, Most of the time they present after 5 to 6 years after the menses stop. A small spotting may be there, and then they neglect it because the spotting, they would have thought that this is a normal thing for their age. They neglect it, and this is the two most common cancers which presents in the similar way. Postmenopausal bleeding, that is either a cervical cancer or a uterine cancer. Uterine cancer is the most common cancer in the US. In India, it's a cervical cancer, which is the most common cancer. So the usual time for in Indians, from the time the cancer is symptoms present to the time of diagnosis, around 5 to 10 years. So they take around 5 to 10 years before they come to us. The usual age is around 60 to 65. We ask them, they will tell that the symptom is there. Once in a while, they develop the spotting and they would have ignored it. So it is very easy to tell someone how the symptoms are, uh, how to detect it, because it's your own body. You can detect the symptoms pretty early. You can tell your grandparents the symptoms about it, or your relatives the symptoms about it, and it's pretty easy. You don't need hi-fi tests to diagnose this cancer. Once the symptoms develop, a simple brush test is needed. It's called a PAP test. But in India, there's also another simple test called VIA, visual inspection by acetic acid. It takes a few minutes, and it is a simple brush test. Like how you brush your teeth. Similarly, the mouth of the cervix, the mouth cervix is a small brush is rotated, and the result is available pretty soon. So it's a simple test and very easy to diagnose. But yes, it is preventable because uh, by the age of before the age of marriage, if you take this vaccine, this cancer can be prevented. And this vaccine is available since 2005. So it's 2023, and most of our students wouldn't have taken it. Yeah, so up to 25 years, the vaccine is available. From 50 years onwards, I would suggest to start explaining them symptoms once the menopause begins. If the symptoms, that is bleeding, starts a couple of years later, think of this cancer and show it to your doctor. Don't ignore the symptoms. A small spot of blood in an elderly female, think of cervical cancer if it is arising from in a menopausal lady. The treatment is simple. Earlier the stage, surgery is better. Later the stage, radiation is better. So there are two treatments for this, either surgery or radiotherapy. The second most common cancer which we commonly encounter is a breast cancer. This is also because of lack of awareness. And it can be, if diagnosed early, the treatments are pretty simple. You just have to remove the lump. If diagnosed late, the surgery becomes more complicated. The treatment also becomes more complicated. So this session is to create an awareness about these diseases, bridge the gap in the knowledge aspect, bridge the gap in the gender aspect, telling them that such a such disease can occur, and we need to be aware of it. That doesn't mean that all breast lumps are cancer. Majority of the breast lumps are not cancer. 80 to 90% may not be cancer. These are the normal lactiferous duct occurring, enlarging during the hormone phase of your menstrual cycle. In a age 20 to 45 years before menopause, these glands increase in size periodically with each cycle and decrease in between the cycles. So they usually present with a painful breast lump, and they are usually fibroadenosis and nothing much to worry. If it is a painless breast lump, then that is where we need to be worried about. In India, that's a major concern because the painful ones come early to us. They think that is cancer and they are younger age, whereas the painless ones, which are usually malignant, which are usually cancer, are not shown to the doctor. So in cancer, the common myth is pain means cancer. Usually it is not so. It is usually painless in the initial couple of years. So a painless breast lump is which I'll show the other signs and symptoms. We need to think of cancer, especially in the age 40 to 60 years. We need to think of cancer. So there's something called self breast examination, which is done every month, 1 week after your each cycle, 1 week after your menstrual cycle. So probably if your menstrual cycle ends today, next Saturday you can examine your breast. And there are two parts about it: looking and feeling for it. And what are you looking and what are you feeling? Looking can be done with arms by your side. Looking at the breast, looking at the nipple, looking at the armpit. What are we looking? These are commonly a painless lump, and the skin of the breast can be like a orange skin. This is also called a PUD, orange appearance. The nipple can go inwards, or blood-stained nipple discharge, or there can be a swelling in the armpit. These are some of the signs of breast cancer, and these are usually ignored because they are painless lump. Who come to us are the ones who are a painful lump, which are a normal part of a development in a female, which are fibroadenosis, which varies with each hormone cycle and nothing much to worry. Whereas a painless lump are something which we need to be worried about, but they are usually ignored by the patient and the family members too. They think painless is usually not malignant. It is not so. So we are looking for the breast lump, we are looking for the lump in the axilla, armpit. We are also looking for the changes in the nipple, and we are looking for the changes in the skin, and we are looking for blood. This can be looked once a month after the age of 30 during each cycle. And it's a very simple thing. Just we need awareness about what are we looking for. And after that, we need to feel each of the breasts, predominantly in females. Males also do get breast cancer, but it is pretty rare. And feeling can be done in clockwise, anti-clockwise, or up and down. So either of the ways we can do it. Whichever way you're comfortable, do it. Do it with not the fingertips, but the pad of the finger, not the edge of the finger, the pad of the finger. Examine the armpit also. And if you feel a lump, please consult your physician, nearby doctor, gynecologist, or any doctor. They will be able to guide you better. So that was self-breast examination. This is clinical breast examination done by the doctor. This can be done after age of 40 yearly months. Once anything is detected by the doctor, he will suggest a mammogram or a ultrasound breast. But despite all these awareness programs which we take, what usually patients come to us is an advanced stage where they have this lump from last 3 to 5 years, and it would be fungating, ulcers would be there, maggots would be there, worms would be coming out, and they will have spread. It would have spread to the lungs, liver, bone, and they would be a terminal stage. Even in that stage, we can prolong their survival for 5 to 10 years. But yeah, if it was cured, they would have lived a normal life. That is why we are trying to create more awareness and more education about this cancer, because these are the two most common cancer, and they don't need any hi-fi tests, no PET scan, no CT scans, no MRI. Just awareness about these disease, postmenopausal bleeding, and a painless breast lump. Think of either the breast cancer or cervical cancer. And these are the two most common cancers in India. Awareness about the vaccine in females also helps. For cervical cancer, there's vaccine only for one of the cancers, that is cervical cancer. That's the second most common cancer in India. No other cancer, no other common cancers has. There's also one for liver cancer, hepatitis B. Now we have other problems also. So gender gap is the two most common cancers I've already told. There are the other gaps which we face in normal practice. That is the education problem, the economic status problem. Poverty also plays a major role. Economic status, there are two ends of the spectrum. The poor have their own problems, the rich have their own problem. The rich have the problems with the WhatsApp University, where they believe each and everything what is come on the WhatsApp University. The poor have the problems of their hospitals being very far. They have little access to it. Financial problems coming to the place of treatment, lack of awareness of the disease and the treatment options, lack of screening facility. Whereas the rich have the other end of the spectrum. The problems faced by them are obesity. Obesity itself leads to 5 or 6 different cancer. The common cancers associated with obesity, one most commonest is the breast cancer. If you are postmenopausal, 50 years plus, and you're obese, the first thing you develop is diabetes. The second thing you develop is its brother, hypertension or cholesterol problems. After that, breast cancer comes or uterine cancer. So in India, it's the other way around. That is, they may not be obese, so they are thin but metabolically obese. So in India, the diabetes patients are not like the world diabetes patient. World, the diabetes patients are usually really heavy, whereas in India, they are usually thin, and the body fat is cholesterol levels and will be pretty high. So they are thin. Most of our patients say the same thing. Sir, they work the whole day, but still they have diabetes. So what they're eating, they're not concentrating on, or their stress factors are too high. So what causes cancer? Causes cancer, there are multiple factors. The three most things are the genetic factor, the environment factor, and the chance. Cancer is basically a cell which keeps growing on its own. For example, a blood cell has around a lifespan of around 120 days, and then it dies on its own. But if it doesn't stop, it doesn't die at 120 days, starts growing on its own, RBC, then we call it blood cancer. Similarly, each cell in our body has its own lifespan, and there's a switch on button, switch off button. If that doesn't happen, apoptosis doesn't occur, they start dividing uncontrollably without any signal, then cancer develops. So the environment factors commonly which everyone says is smoking, but this is the third most common cancer. But yes, it is a major preventable cancer. Smoking related cancer is a major preventable cancer. We need to highlight this as much as possible in the youth, because a healthy lifestyle is all that is needed. Avoiding smoking will reduce the cancer by almost 30%. Most of the cancers 30% of the cancers can be avoided. So it can be in any form. It can be tobacco, it can be aracanate, it can be chewing tobacco, gutka, pan masala. What movie stars suggest are you're directly going to a field of cancer. Pan parag or whatever it is, you will end up land in the field of cancer with whatever products they highlight on. So tobacco consumption is a leading most common. 30% of cancers are because of tobacco consumption. There are 13 different types of cancer. It not just affects you, it affects your family members. Your wife may develop passive smoking and she can develop lung cancer, or children can develop. If the parents are smoking, the children can develop acute myeloid leukemia. So there are 13 different types of cancer and all are related to smoking. I know you're all adults, you know what is good for you, but yeah, we can all reduce the suffering. The first thing which a smoker says is, sir, we'll all die, but we can reduce the suffering by stopping smoking, at least smoking or tobacco in any form. So there are 13 different types of cancer which are associated with smoking. It is not just one cancer. There are multiple cancers, and each is deadlier than the other. Other one which we say is a bad lifestyle, obesity. Obesity is the second most common. 25% of cancers are because of obesity. The cancers associated with the colon, gallbladder in North India, postmenopausal breast cancer, endometrial cancer or the uterine cancer, esophageal cancer. These are the common cancers associated with obesity. The more obese you are, the higher the risk of developing gallbladder, postmenopausal breast, endometrium, and esophageal cancer, lower esophageal cancer. Less commons are the alcohol and infection. We need to highlight this because there are many cancers which are preventable by infection, by vaccination. Hepatitis B can be vaccinated, hepatitis B vaccine, and we can reduce the incidence of hepatocellular carcinoma. I've already spoken about cervical cancer, human papillomavirus. There are other virus-associated cancer, but they are lesser in number. Genetic. The most common misconception is no one in my family has breast cancer, so I will not develop. Only 5% of breast cancers are hereditary. 95% of them are sporadic because of the complex interaction between your environment, your own lifestyle, and your genes. So the common misconceptions which the poor or the rich have is cancer, first thing, is a death sentence. It is not so. The 5-year survival in cancer is almost 60%. So cancer is like diabetes and hypertension. It's become a chronic disease right now. We can improve the quality of life, and we can definitely cure in early stages. The moment we ignore the symptoms, cancer will go on its own. It is not so. Cancer is painful in early stages. Pain is an early sign. This is also a common myth. Most of the times, cancer is painless in early stages. And the diagnosis of cancer doesn't mean that he's going to die the next day. That happens only in movies. In real life, they will survive with good quality treatment for up to at least 5 to 6 years. And if early stages, 10 to 15 years, 20 years, lead a normal lifespan also. There are some cancers at any stage they can be curable. Thyroid cancer, some subtypes of breast cancer, prostate cancer, pediatric cancer. These have excellent survival, close to 90%. And the other common myths which everyone asks us is, will eating sugar make my cancer worse? That is, usually some of your family members may be suffering from this disease, and they will ask you, can I eat that? Can I eat this? There is clear-cut research saying that whether you consume sugar in any form or don't consume sugar, it is not going to progress. So avoiding sugars will not worsen your cancer, or taking sugar will not worsen your cancer. There is no relation between amount of sugar consumed versus with your cancer worsening. So if you have a cancer patient, he can eat all the diet, he can add sugar also to its diet, and it is not going to worsen his cancer. This is your WhatsApp University which says don't take sugar. It is not so. The other one is a positive attitude. If I'm happy, cancer is going to go away. If I'm sad, cancer is going to come back. It is not so. It depends on the type of cancer, the stage of cancer. It's only in movies which they say, yes, that you have a positive attitude, your cancer is going to be cured. It is not so. It depends on your stage, depends on what subtype it is. There are a lot of other factors too. A positive attitude has some impact, but it is not the only thing which determines. The usual asked question by our patients are, can a biopsy spread the cancer? It is not so. The other question asked by our students are, do cell phone causes cancer? No. Do phone lines or phone towers produce cancer? No. Are there herbal products that can cure cancer? No. Usually herbal products can reduce some of the side effects of our treatment. Like aloe vera can reduce the skin discoloration because of radiation, or honey can reduce the mucositis because of radiation. There are some of the side effects which can be reduced by herbal products, but it's not going to cure cancer. Just because we are not allowed to advertise, that doesn't mean that herbal products will cure cancer. It is not so. It can reduce some of the symptoms. Yes, we need to use it, but always ask your oncologist what can help in reducing the symptoms of cancer. So cancer is not a communicable disease. If someone in a family is suffering, we can touch them, and touching will spread only love and nothing else. Cancer will not spread by touching, and all cancers are not hereditary. These are some of the common myths and misconceptions the WhatsApp University spreads. If in doubt, always ask your treating physician or your friend who is well versed in knowing these diseases. The poor also have problems with the screening facility. That is, I've already told the pap test. I've also told about a mammogram. Pap test is for the cervical cancer and mammogram is for the breast cancer. Head and neck cancer also can be commonly screened, and it is very simple. How do you screen them? Anyone can screen. You don't need to be a doctor to screen it. Anyone who is chewing tobacco or smoking tobacco in any form, BD, gutka, pan, or cigarettes, uh, if they ask, how do I screen for cancer? It is very simple. Uh, for head and neck cancer, it's pretty simple. You examine the 7 areas of the mouth. You examine first the lips. You lift the lips, say this part, lower part of the lips, upper part of the lips, lower part of the lips, the buccal mucosa, which is in between your teeth, then the gingiva, which is just above your tooth, on both sides, inside and outside, and then the tongue, the front aspect and the lateral aspect of the tongue. Once you inspect the tongue, the floor of the tongue, floor of the mouth, the roof of the mouth. These are the areas, and the back. We look for tonsil and the posterior aspect of the mouth. These are the 7 areas which you all suggest to examine. What are we looking for? We are looking for how is the mouth opening, whether normal mouth opening is around 3 finger breadth. If it is less, 3 fingers. If it is less than 3 finger breadth, then we are seeing something abnormal, or we are looking for a white patch or a red patch. These white patches are leukoplakia, which are present for more than 2 weeks, and a red patch which is also present for more than 2 weeks. These are some of the signs and symptoms which we are looking for in cancer. Usually the patients have an ulcer. Patients come with an ulcer which is painful, which is present only for 1 or 2 days. These are usually abscess ulcer and they are not cancerous. If they are present for more than 2 weeks, painless, and they are white or red patch, and when they scratch it and it starts bleeding, that is when we are suspecting a cancer. So, not a painful ulcer, a painless ulcer. Abscess ulcers are usually painful, but they usually subside within 1 or 2 days, maximum within 7 days. Whereas a cancerous ulcer, usually a white or red patch, takes around, will be present for more than 7 to 20, more than 2 weeks. And it bleeds on touch. These are some of the signs and symptoms of oral cancer. Why are we stressing on these 3? Because these 3, that is breast cancer, cervical cancer, and head and neck cancer, constitutes around 66% of all cancers of India. So if we can highlight and screen these, provide awareness, we can reduce almost 66% of all cancers in India. And this cancer, oral mucosa, buccal mucosal cancer, is also called worldwide as Indian oral cancer, because this is not seen in rest of the world. Only in India we chew tobacco and keep it in our mouth like a lollipop in the side of the buccal mucosa, and that is where the cancer develops. Rest of the world smokes tobacco. In India, we chew tobacco. It can be in the form of aracanut or betel nut or any other form. Gutka, panparag, whatever you call it, these can produce cancer in the long run, and they usually present at least 1 or 2 years prior as a white patch. After you boil milk, you get a kene, what we call, and that is a white patch is what we are looking for, and which when we scratch it, it bleeds. This is a sign of a leukoplakia or erythroplakia. If we ignore it, it goes in the later stage as an ulcer. An ulcer present for more than 2 weeks is cancer in a smoker or a one who chews tobacco. In the tongue also, it can present as a white patch which keeps on increasing or burrowing inside. Why is oral cancer such a concern? Because in India, it is easily preventable. We need to prevent this. But what happens is our movie star promotes promote gutka, pan masala, ignoring what are the side effects of this gutka and pan masala. Even pan masala produce these cancer. Even when you go to movie theaters, they will suggest that such and such consumption leads to such and such disease, but people ignore. It is ignorance sometimes is not bliss. So do not neglect this warning sign. If ulcer presents for more than 2 weeks, always do a biopsy. We do a color test, Lugol iodine or methylene blue, and do a biopsy. If the color changes, then we're looking for cancer. It's most often preventable because of our habits, and it's most often curable if detected early. What happens is people come pretty late. So earlier the disease, smaller is the surgery. Later the disease, bigger is the surgery. Lesser pain, lower cost, more cure. So we always suggest do all these awareness programs so that if someone has a white patch in the mouth and is chews tobacco, don't ignore the symptoms. There's also the urban-rural divide. The rural patients may not have the uh, screening facility, or they may not get the appropriate treatment. They may have lesser follow-ups. They may not be included in clinical trials, and long time travel to reach the cancer center may be a or more financial burden. These are the common problems which are rural patients present. I know in India, because of the huge population, this is gonna increase with time. The rural patients, because of lack of awareness, lack of financial support, cancer is gonna increase. But yeah, we have Ayushman Bharat, lot of government schemes where cancer treatment for BPL card patients also is free. Excuse me. This is highlighted by one of the thing is in India, we have 670 radiotherapy machines. That is one in every 21 lakh population. Ideally, we need a radiotherapy machine for every 2.5 lakh population. And more than 60% of these machines are in the state capital. So there is a rural-urban divide. We need more machines in the rural population, also rural areas also. There's also an age barrier. So I've spoken about the gender barrier, rural-urban barrier. There's an age barrier. We would like to reduce this gap also. Older age patients are less represented in clinical trials. Older age patients receive less aggressive treatment. 60% of cancer deaths occur in age more than 60 years. So higher age, higher is the death because of cancer. There are some of the warning signs which are usually ignored in elderly patients. These are also called caution. CAUS. C is for change in bowel and bladder. A is a sore throat that doesn't heal. Unusual bleeding in the postmenopausal lady or bleeding in stools. Unusual bleeding in between periods. Thickening or a lump in the breast. Indigestion or obvious change in mole or a nagging cough. I'll explain each of them in detail. Usually you would have seen a movie called Piku where Amitabh Bachchan says, I'm at the age of 60 plus, he says, I have difficulty in passing motion. He's constipated in the movie Piku. This is usually ignored in elderly, telling that this is piles. It is not so. If it doesn't resolve in 1 or 2 weeks, kindly show your doctor. Because in India, they usually come after a year and they're diagnosed with bowel cancer or colon cancer. If you have change in your bowel and bladder habits, don't think it as piles, especially in elderly. Think of colon cancer also. This I've already explained in detail, head and neck cancers. Unusual bleeding, it can be a postmenopausal lady, especially you are looking at cervical cancer. A lump can be anywhere in the neck, armpit, and if it's a painless lump and it's a fixed lump, always show it to a doctor. A mobile lump may not be cancerous, it is common, whereas a fixed lump, fixed to underlying structures, cancer usually wants to fix itself, get a good blood supply, fixed to the skin or underlying structures, and that is where we are looking at cancerous lump. Indigestion, difficulties to swallow are the early signs of either a stomach cancer or ovarian cancer. A change in skin, mole or wart can be a sign of skin cancer. A nagging cough. This also Amitabh Bachchan keeps saying that more than 2 weeks of cough, test yourself for TB, tuberculosis, As an oncologist, we say if your tuberculosis is negative, always check for cancer. So 2 weeks of cough, it doesn't subside, think of tuberculosis. Tuberculosis is negative, always rule out cancer. And it can occur in both male and female. In females, elderly females, it's because of the firewood they would use in the previous. Now majority of our females in our era would use the LPG gas cylinders, but the previous decade people used firewood for cooking. So cancer is common in females also. It can also be related to the house asbestos, the shielding. These treatment facilities, these 7 warning signs are the signs of cancer, and kindly don't ignore it. The treatment can be given under any Ayushman Bharat scheme. Any patient with a BPL card can go to a nearby government hospital or a medical college or a private center and get this cancer treatment free of cost. Some of the cancer treatment free of cost. It can be surgery, radiation, or chemotherapy. Surgery is an operation to remove the disease. Radiotherapy is a radiation where they focus some light gamma rays into the breast lump or wherever the lump is and reduce the size of these disease. And chemotherapies are injections or tablets. And there are so much advances right now that we have treatments like immunotherapy, targeted therapy, where the side effects are pretty minimal. Even in surgery, we have advances like robotic surgery. In radiotherapy also, we have tremendous advances. So cancer has become almost like a chronic disease right now. So we have Ayushman Bharat scheme, or we have other schemes like ESI, CGHS, ECHS. I'll be concluding my slides in the last. These are the last 2 slides. So the talk was to promote awareness about this disease, promote awareness about disease in females, about the vaccine available up to the age of 25, the screening test from 25 to 40 or 40 plus. Kindly examine your breast monthly once in your bathroom every month, at least a week after your menses. After the age of 50, can you get a scan done for breast cancer? And after the age of 50, if you have any postmenopausal spotting, bleeding, kindly show your doctor. For elderly males, or if you have elderly gentleman in your family or elderly woman in your family, if any of the signs and warning signs and symptoms are there, kindly don't ignore it. That is a painless lump, or a change in your bowel and bladder habits, or a skin change which keeps increasing, cough, nagging cough, an ulcer which doesn't subside in 1 or 2 weeks, or you lose weight, or you have difficulty in swallowing. These are some of the early signs of cancer. Kindly don't ignore it. So educating the public about cancer prevention, you can all take it up, educating your public, because people will come to you, ask for more knowledge, because they will think that you are more knowledgeable about any disease. They will ask you. And we can tell them about stopping and having a healthier lifestyle, tobacco and alcohol cessation. Tell them about the screening programs which we have, and how to examine a simple breast oral cancer can be simple examined by a white or a red patch which bleeds on touch. The obstacles are many, but there's always hope. And the first step is recognizing that these are so many obstacles which we have, creating awareness about the vaccines and a lot of things which we have available in India. And we can understand this gap and reduce the gap in cancer care. Thank you. Hello.
Thank you so much, sir. It has indeed been a very insightful and knowledgeable session for us, and we would like to extend our sincere thanks for putting forward the various important details regarding the condition of cancer, and more so because most of our joinees are students and women. So the importance of diagnosing breast cancer and cervical cancer for in case of women, and the monstrosities of chewing tobacco and smoking, that
Okay,
has been enlightening us.
there's also one more cancer, ovarian cancer, which is usually in a postmenopausal lady, because females, you said. There's one more common cancer, postmenopausal ladies. They'll have indigestion. They will take this gastric medicine for 1 2 months, 3 months, they keep continuing taking Rantac or PAN, and then a year later they are diagnosed with ovarian cancer. Usually ovarian cancer is a what it is, has very minimal symptoms. So if your gastritis is not coming down in an elderly lady, think of ovarian cancer also. I forgot to explain this in the slide. Since you said female, I thought let's tell about another common cancer in females. That's ovarian cancer. It's very has very minimal symptoms.
Okay, sir. So we all know that we still have certain queries in our minds regarding this topic. So with that, we will now open our questions and answers round. You can raise your hand and put forth the inquisitive questions as we prompt your name. So sir can answer them. Megha ma'am, we can take your question.
Yeah, hello, sir. Sir, I have a
Right.
question. Why there are less chances of conceiving and pregnancy in women after the breast cancer?
Okay. Most of the time, breast cancer is hormone related. That is ER/PR positive, and that is hormone related. Most of the time, is obesity and things. So the treatment what we give also suppresses the ovulation. So ovulation basically our cycles reduces. We may stop women may stop menstruating for a moment you give these drugs like adriamycin for 1 to 2 years. So the risk, the fertility also comes down. So, moment the cancer is diagnosed doesn't mean that they're going to be infertile. After treatment, some of the cancers, they may become, the chance of conceiving is less. Understood? This is because of treatment related. It can be because of radiation. Radiation to the abdomen can reduce, or it can be because of surgeries which are done, or it can be because of chemotherapy itself. So many points are there which can reduce the chance of conceiving. But patients do come to us 5 years, 10 years down the line with their children going to school and show to us. So I have still have patients who have come with their 10 children showing the 10th standard marks card also. They do conceive. So it is a misconception. Majority of them do conceive. Some of them don't conceive. Depends on what time the chemo was given, when was it given. For example, if you give a child up to 10 years any chemotherapy, they're going to conceive because their ovaries are active only after puberty. So the thing is, depends on what other factors also. There are a lot of factors which take into consideration. It is not just one disease and one treatment producing infertility. I hope
Okay,
I've
sir.
cleared your doubt, or are you more
Yes,
confused?
sir.
I can see
I
a
can
few
see.
questions in the chat section also. So there is one regarding the recent nanoparticle development in cancer treatment.
Okay. The nanoparticles which are available right now in practice, some of them like NAP, paclitaxel, these are useful nanoparticle paclitaxel. Paclitaxel is a drug which we are given in cancer therapy, and nanoparticle paclitaxel is a drug. So cancer is smart, like how we think we are smart, we try a new way of treatment. Cancer outsmarts us. So it produces a strong, thick wall around it called fibrosis. So the drug may not enter the treatment what we give may not enter the cancer cell. So we need smaller and smaller particles, albumin bound techniques or nanoparticle bound techniques, which can go directly into the cancer. This is especially useful in some cancers like pancreatic cancer, where the amount of fibrosis around the tumor are pretty high. Not in all cancers, some of them it is very useful. It doesn't mean that one cancer, one treatment, all cancer, same treatment. Each cancer is different. For the same person, the same stage, two patients may have two different treatment because the subtype of disease may be different. There are a lot of variables. Just because one person responding doesn't mean that the other person may be responding for the same or may not be responding. I can also see a question about, can PCOD cyst lead to ovarian cancer? Uh, PCOD cyst may not lead to ovarian cancer, but long-term infertility can lead to ovarian cancer. That is, uh, there are two common cancers which are common in infertile ladies. That is commonly, if you say religiously, it is like nuns. the nuns, they don't conceive. The function of the breast is child feeding the child. If that doesn't occur, the risk of breast cancer increases. So if that doesn't occur, similarly, if the ovaries are exposed to repeated cycles of estrogen, then there's something disease called PCOD which develops. This is also associated with obesity. So can PCOD lead to ovarian cancer? PCOD is a common disease in females. Not all PCODs leads to ovarian cancer. Straightforward answer. PCODs occurs commonly in the age of 18 to 20. Once you conceive, the risk of ovarian cancer comes down. The PCOD also normalizes. So this comes down with age. Once your hormone cycle regularizes, usually the first 3 to 5 years, your hormones are a bit erratic. The estrogen progesterone cycles are a bit erratic. That is where PCOD develops. But over time, they regularize. That is, by the age of 25, most of them regularize. You will be able to conceive, and your risk of ovarian cancer reduces. So PCOD directly doesn't lead to ovarian cancer. Infertility leads to ovarian cancer.
So there is one more question in the chat box by Abhinav Babu, that do radiation therapy have any contradictory effect, or are there any chances of making cancer worse?
Okay, it depends. So basically, there are if I can explain, radiation is not one treatment. There is the government buses, there's the private bus, there's the super deluxe train, and there's a aeroplane. So these are the 4 or 5 different types of radiation. Depends on what type of radiation is given and for what cancer. So the basic one is 2D CRT. The deluxe patch which everyone uses is a 3D CRT. The super deluxe airplane is an IMRT, IGRT, and the aeroplane, super deluxe train, and the aeroplane is so we have different types of radiation treatment. So depends on what radiation was given. Standard, we say 3D CRT is a standard treatment for majority. So radiation treatment can worsen can worsen the quality of life if the family is not supportive. That is, during radiation, depends on where the radiation is given. If it for head and neck cancer, they may have difficulty in swallowing. That is where the family members make a huge role. Putting the food into mixer grinder, asking them to helping them in making food easy to digest, easy to swallow. For example, if radiation is given to cervical area or the bowel areas, they'll have loose motion, helping him out with the treatment aspect. So radiation doesn't worsen. You will have some of the symptoms which are easily controllable, but if you ignore the symptoms, you can have worsening of your quality of life. So radiation per se will not worsen the quality of life. Radiation minus the family support can worsen the quality of life.
Kunal Verma has asked, could any drugs or supplements affect treatment of cancer in negative way?
There are some of them which are proved, some of them are not proved. For example, multivitamin supplements in a cured head and neck cancer. That is, a patient was smoker, and you give them multivitamins after cancer is cured, they can have recurrence of cancer. So in a child who we give multivitamins, this is very easy to understand. If the blood cancer, we give a drug called methotrexate, which is an antimetabolite. We give folate, which is a metabolite, meaning so you're basically mixing both things up, and none of them will work. Neither the methotrexate will work nor the folic acid will work. So you want the child not to improve, you give multivitamins, the child cancer will not be controlled. So in childhood cancer, we usually tell, don't give multivitamins till the cancer is under good control. The first 1 or 2 months, don't give multivitamins till the cancer is good control. Moment the cancer, we achieve a good control of cancer by some of the drugs, then we can give multivitamins. This is in childhood cancers. Whereas in adults, it's the other way around. The tobacco and smoking can produce free radicals and produce bad effects on our genes, uh, free radicals. Similarly, these multivitamins, vitamin E, supplements can increase this free radical injury and make us more prone, if the patient continues to smoke, more prone to develop these cancer, head and neck cancer. So there are some of the supplements which can affect cancer in a negative way. These are for curable cancer, whereas patient is in a terminal stage, not curable cancer, stage 4, we can always supplement them with multivitamins. That is, end stage, if they are not eating, we can definitely supplement them so that their quality of life improves, the mucositis, oral ulcer reduces. So it is a double-edged sword. Always ask your doctor, what are you supplementing? They will be able to give a better reply, because we can't generalize that multivitamins are bad or supplements are bad. They are good in some terms, they are bad in some. So we, for example, if the dose of methotrexate is too high, to reduce the side effect, we always give folinic acid. So there are ways where we give multivitamins, there are sometimes we don't give. Always ask your doctor before you blindly supplement yourself, if there's some cancer patient in your family.
There's just one last question in the chat by Menas Parveen, that can
No.
hypothyroidism lead to any infertility and further development of any cancer?
No, because in hypothyroidism, you'll always be taking a thyroid supplementation, so that will not produce infertility. But the problem is, if you're hypothyroid and you stop working, stop doing exercise, you put on weight, then infertility and obesity can prone for cancer. It's obesity part of which we can prone. It's not the infertility. It's not the hypothyroidism. That doesn't mean that obese patients are more prone for cancer. We have sumo wrestlers in Japan who are really obese and they still don't develop cancer. This is because of their lifestyle. That is, they are very, very, very active. That doesn't mean that I just want to be eating like a sumo wrestler and don't do any activity like a sumo wrestler. Do the activities also. I'm not saying that the thin person will not develop cancer, or only the obese patients develop cancer. Keep a healthier lifestyle is what we are trying to say. So if you want to know, for a person who is not very active, what is the actual weight for them, you minus your height minus 100, height in centimeters. So if you're 160 centimeter, your weight should be around 60 kgs. You're 170 centimeter, your weight should be around 70 kgs. 180 centimeters in height, your weight should be around 80 kgs. I hope that clears the doubt about how much should be your weight. You may feel I'm not obese, I'm very thin or very obese. Just minus your weight minus 100. That is sufficient to get a plus or minus 5 to 10 kgs is okay.
Yes, sir, that clears so many of our doubts. Thank you so much for that. So to conclude today's session, I would like to invite Shivam Pathak, Central Secretary, SPER Student Forum, for delivering a vote of thanks.
Thank you.
It gives me an immense pleasure to deliver a vote of thanks on this virtual expert talk on World Cancer Day. Cancer is indeed a major concern in current healthcare scenario, and closing the care gap and early detections are the only ways to save lives. With this, I would like to thank Dr. Guruprasad Bhat sir for giving his precious time. It was very encouraging and enlightening session for all the attendees. Our country needs doctors like you in this united fight against cancer. Also, I would like to extend my gratitude to Dr. Upen Nakai sir for always being there for us as our support and strength and source of motivation. Also, I'm grateful to Dr. Usama Asher sir for being our mentor and a guiding lamp for us. And lastly, I want to extend my gratitude to all the attendees of the meeting for their patient listening. Thank you all.
I would like to thank the Society of Pharmaceutical Education and Research. Thank you for giving me this opportunity. It was wonderful. Thanks a lot.
Thank you. Thank you, sir.
Thanks each and everyone for your time.
Thank you, sir.
Thank you so much, sir. It was so
Thank you,
nice
sir.
connecting with you.
Thank you.
And with this, we would like to conclude our today's session. Thank you for joining.